Hello everyone, welcome to my channel. My name is Josue and I am a registered nurse. This channel is dedicated to NCLEX review material to help those studying for the NCLEX get content review in a visually pleasing and enjoyable way. For me personally, I'm able to make connections and really get a grasp on material when it's relatable and I can create images of it in my head. That brings me to why this channel is so unique. As you're watching, you're probably wondering how GTA has anything to do with the NCLEX. Well, it doesn't. In fact, video games are a de-stressor for me and a lot of people. So with this channel, I'm going to teach NCLEX content using examples from various video games that I play. I think it'll be fun and help those especially who enjoy video games make the content stick. Even if you don't enjoy video games specifically, it might help with recall on test day. So one of the most useful topics that I could teach for test day is prioritization. Prioritization is one of the more difficult topics within the NCLEX. We're going to look at various patients that are coming into the emergency situations and figure out which one we should treat first or see first. Okay, it looks like we got our first one. She is 24 hours post-op colectomy and has just received morphine 15 minutes ago. This is an interesting patient because one of the things we worry about when administering opioids is respiratory depression, which could raise alarm and lead to death. Although this is a possibility, the answer doesn't say anything like that, so let's not assume. It's really important that we don't assume so that we avoid going down the rabbit hole and overthinking questions. Okay, looks like we have our next patient. This patient is 48 hours post-op open gastric bypass surgery. Now reporting nausea and dry heaving. Now this patient, if you could imagine, is probably in a world of pain, and that's because they just had abdominal surgery. Now, if you could imagine having your stomach sliced open and then closed again, and along with the force from throwing up on top of that, it sounds like a disaster. And besides that word onset, new onset, that's very important, that's key. One of the biggest concerns is wound dehiscence and evisceration, which is a medical emergency. I'm sure you guys remembered how that looks. Basically, the wound opens up, and with evisceration, you can see intestines start poking out. All right, so our third patient is a patient with cellulitis from IV drug use, and they're threatening to leave AMA. So this patient isn't too critical, and he's not one of our major worries. And then our fourth patient is a patient who just had a total knee replacement, 72 hours post-op. This patient here is very stable as well. There's no mention of any dangerous signs. So, out of the four, the patient that we need to prioritize is the gastric bypass patient. Okay, we just got 3 more patients, and we're in a new scenario. Our first patient is 48 hours post-op abdominal surgery and receiving enoxaparin for VTE prophylaxis. Our second patient has hypertension with a blood pressure of 188/96 and is receiving IV hydralazine. And finally, our third patient is a sepsis alert with a temperature of 102.5 degrees Fahrenheit and needs to receive their first dose of cefepime. All right, so which one should we go see first, guys? Comment down below. You guys should pause the video to, comment down your answers. So if you selected the sepsis alert patient, you are correct. Because out of the 3 patients, the sepsis one screams to me the most, mainly because death can happen a lot quicker for this patient. Remember, this is an infection in the bloodstream, and we need to act fast before it progresses to shock. And then, with shock, it could lead to multiple organ failure. And, that's not good. So yeah, if you guys want me to go over the other patients in better detail, I can do that as well. I just went over the priority patient, and I can always include the other answers as to why they're not. Looks like we got paid $450 for saving 3 patients. So yeah, we can move on. We got three seats open. Let's find 3 more patients. All right, looks like we got our first patient. She's 24 hours post-op AAA repair with no bowel sounds in all 4 quadrants. And then here we have our second patient coming up. This patient is a 2-year-old who ingested a battery about 20 minutes ago and is showing no symptoms. Doesn't look 2 years old in that video, but we get the point. And then our third patient, he's coming up right now. He is he's a DVT and is walking to the bathroom. That's the scenario for him. Out of all the 3 patients, which one should we prioritize the most? Please comment down below and let me know what you guys think, and then we can move on and figure out which one is the most critical. So if you guys picked the 2-year-old who ingested the battery, you guys are correct. This patient is our main worry. Although asymptomatic, the battery can be very corrosive to the esophagus and become life-threatening. This is actually an emergency, and we need to remove the battery ASAP. Again, if you guys want more information about the other patients, please comment below, and I'll go through the comments and help you guys out in any way I can. I just wanted to thank you all for coming and checking out the channel, checking out the video. Please like, share it. That would be a great help so I can continue this. And I enjoyed it. I hope you all enjoyed it. And just thank you for taking a look at the video.